Good to have you on the podcast, Mike and Josh. Really excited to have both of you here.
It should
Yeah,
be here.
thanks for having us.
So I think most of our viewers at this point know of SmarterDx, but whichever of you want to kind of start off first, but would love a quick overview for those that are listening that are maybe just hearing about you for the first time. Again, I don't think that's the case, but I like to reach those people as well. So a little overview of the company, what you do, and how the over 50 health systems today are using your platform, whichever wants to start.
Yeah. Um, so at a high level, what we do is we help hospitals fully capture the patient journey and get paid and reimbursed for the care that they delivered. And, you know, I'm sure most of your listeners here are deeply familiar with revenue cycle and, the depths of it. When I talk to people outside of healthcare, what I often say is, it's really complicated, but revenue cycle is just the process of generating a receipt for the care provided and getting paid on that receipt. And what we do is we take in the underlying clinical data, the labs, the medications, the orders, the vitals, the things that the physicians and nurses actually did, and use that data to infer what actually happened to the patient in the hospital, and then use that to check that the documentation and the codes are correctly representing that care. And then by helping hospitals kind of fully represent that, it improves their revenue metrics and it improves their quality metrics as well.
I like how when you started talking, you said like in simple terms, this is what it is. Why? 'Cause I know it is more complex than that, right? But why? I mean, this happens across healthcare. Why do we continue though to maybe overcomplicate? Like, I'm grateful that Smarter DX exists, but I feel like throughout history, we've just continued to overcomplicate it in every area, not just healthcare. Whenever we've overcomplicated certain things, it seems like we've had the least amount of progress. So, would love to hear from both of you to understand why this particular business it's important to find the moments to simplify.
It really is an accident of history that revenue cycle exists the way it does. And, my dad is a physician, and I vividly remember, going to the hospital with him and watching him sign charts. And the charts at that time, this is, I guess, late 80s, early 90s, were stacks of paper in a manila folder. And that represented the record, right? We didn't have EMRs. We didn't have that system. And you had to find a way to compress all of that data into something that you could meaningfully fax to payers in order to represent the care that was provided. And the system that was created to do that was using diagnosis codes that rolled up to this concept we call DRGs, or diagnosis related groups. And that system has persisted through to today, even though we have now electronic medical records and AI and much better systems of being able to understand the patient chart. And that sort of like accident of history is the complicating factor, right? And that's why the system exists. And we hope to do at SmarterDx is simplify it over time and make it a little more sane. But as a physician, like Mike and I, we don't think in terms of ICD-10 codes when we're seeing patients, right? Like that is just not how we think. But we've yet, because of how the system evolved, we are forced to bill in terms of ICD-10 codes. And that inherent like switch between how doctors think and how the system has been forced to operate like leads to the complexity and why you need technology to really try to solve it and round out those corners.
And I think, kind of more to that point, to some degree, the first generation of software was a digital recreation of the manual workflow. So what I mean by that is if you were a clinical documentation improvement nurse working in a hospital pre-EMR, you had a stack of patient folders and, you'd look at you like take the messiest one, put it up top, and this doctor sucks, you put it up top, and then you do your review in that order. And when CDI software came out the first time, clinical documentation improvement software, it was to some degree, let's create a work list and prioritize for you. And then fundamentally the work would still be the same, but maybe instead of flipping through papers, I'm flipping through tabs, kind of in the EMR. And, now kind of for the first time, AI is at a point where it can actually understand the underlying clinical data. And in that world, what you don't kind of like a prioritization list is itself an outdated workflow. What you want is a model that acts as an assistant to that CDI specialist, goes through all of that data, finds kind of the gap or what they're looking for, and then just like a really good assistant brings it to them for them to kind of exercise that clinical judgment at the end of the day. And so I think it is about reimagining what revenue cycle should look like given today's technology, not just let's use today's technology to better recreate what happened in the past.
Interesting. And another interesting story I want to have both of you tell is the story of how you two met and founded this company is an interesting one. So I would love to hear from both of you of how that came to be. And also, I love asking like founders this question. There's moments along the process of when you decide to start a company. What was the final domino? Because there's those first conversations that happen. What's the final domino before you're like, we're doing this, it's all in? So if you can incorporate that in the story, we'd love to hear that as well, but take it how both of you would like, back and forth, but would love to hear the story.
Yeah, so Josh and I did residency together at New York Presbyterian. We were both internal medicine residents. And we were both pretty nerdy, so kind of did a lot of, data science and, kind of other stuff in addition to residency. And after residency, I became medical director for transformation. So led our applied AI projects. Josh, do you want to talk a little bit about what you were doing?
Yeah, I have a coding background from before medical school and got plugged in with a group at New York Presbyterian doing data science with electronic medical record data and found that to be a really intuitive fit for my skill set. I'd never worked with that sort of data technically, but from a clinical perspective, I interacted with it every day. And so like really deeply understood what the data meant, why it was the way it was, and how to generate insights from that. And that enabled me to solve a lot of problems for the health system and then open doors for me to go down the academic research track for a while, doing NIH and DoD funded data science work and also hospital operational work, helping with the deployment of Epic when Columbia transitioned in 2020.
No, it was actually, Jared, I started working with a revenue cycle team and we had the EMR, a coding vendor, 3 different layers of second level review vendors. We had invested a ton into our CDI and coding teams, into physician education. And after all of that work, we would still have, dollars left on the table for the hospital. And actually, over the course of a few months, I ended up writing some really basic, kind of Python scripts that kind of helped identify almost 5 million worth of value for the health system. And so that's when Josh and I started to, talk very seriously about, hey, if one hospital has this opportunity with very basic, kind of approaches, like if we really, at the time, Google had just published one of their papers on the early transformer models. That transformer is the T in ChatGPT. And so we're kind of like seeing this wave of, kind of more sophisticated AI and sort of like started to think about, okay, great. Like if you imagine doing a much more sophisticated version of what I do, how many dollars are on the table? And we sort of we had kind of a false start actually, which was sort of January of 2020, believe it or not,
Before COVID.
yeah, right before COVID, where we spoke with like 3 hospitals and 2 hospitals were like, oh, we want to move forward with this. So we were feeling really cool, like on top of the world. And
we were like scrambled to form the company. We were like, we were like in contracting. Everything was going super great. We thought this was going to be easy.
Yeah. Yeah. Easy in healthcare too. Anyway, but, and then obviously COVID happened. luckily we're both hospitalists in New York City. You know, uh, it's not like we were immediately unemployed, but you know, I think it was late 2021 when we finally got a chance to do effectively like a pilot at one hospital where we could take some historical data, run our algorithms and show them the findings. And, you know, it was a pretty wild success. Like we just found tens of millions of dollars, you know, kind of for a health system that they were able to validate. And then that was when, you know, kind of we were just like, okay, we need to press the gas on this. At the same time, we got some actual sales, and then kind of very quickly raised some venture capital money and never looked back from there.
Were there any early pivot moments that happened? Like, and it doesn't have to be major pivots, but were there, like, from what you two decided was kind of the initial focus, did little pivots happen along the way from the point you started the company to, you know, basically forming Smarter Technologies today?
Yeah, absolutely. You know, when we started the company, you know, what we were kind of to the earlier description, trying to use our algorithms to help CDI specialists be more efficient on their kind of there's a CDI workflow, concurrent CDI, which is while the patient is in the hospital. And, you know, hospitals would say that's cool, but we get a lot of people saying they have better algorithms or whatever it is. And how do we really know that you're adding value? And the reason why that question was there, we realized, was that when you replace a or when you kind of like insert into an existing workflow, if you make a recommendation, it's hard to prove that you didn't just front run something that they would have identified anyway, maybe the next day or just through the course of their natural work. And so we did something from a workflow perspective that was counterintuitive, which is we moved from the concurrent space to the pre-bill space, which is after all their work is done, but before the bill goes out. And in that space, if we find something, because their work is done, we can really prove to the CFO, like, hey, this is an additional finding that your team wouldn't have captured. And then that, you know, kind of attributability of value is kind of what really, you know, kind of unlocked kind of our go-to-market. And with smarter technologies, you know, I think the kind of question that we had for ourselves was, you know, we want to use kind of this new generation of AI to create so much more value. You know, CDI is great, but there's so many areas from utilization management to denials to charges and so on and so forth that hospitals need help with. And you know, I think it was, how do we sort of bring the resources to be able to kind of expand our footprint and create even more value to our customers. And sort of that's kind of what got us excited about kind of moving from inherently a product, sort of like a one product company, to trying to think about how do you how do you solve problems at a platform level.
And Jared, the pivot there was so critical to so much of our success, really, because it really aligns our incentives as a company. Like our revenue drive is aligned with the health system's revenue. The more value we can find for them, the more successful we are as a business, and the more successful we are as a partner to that health system. That alignment has enabled us to like have both short-term incentives that are driven by driving more value, and at the same time align our long-term incentives towards the core thing that we do as a company, which is understand what really happened to the patient, like understand the patient's story and the patient's journey from the raw data using AI and using technology. It turns out that that same understanding is critical to a bunch of other processes in the revenue cycle, just like Mike mentioned: utilization management, denials, registries. All of these like core health system problems are really fundamentally about how well can you understand what happened to the patient and then describe that in the system that exists for payers to recognize that and appreciate the value that you're providing as a provider. And So, I think that pivot was, the sort of the key step in the unlock. And I think as we move forward with smarter technologies, we are constantly thinking about how can we align the incentives of smarter technologies with the providers that we care about and solve problems that they care about in a way that is mutually beneficial for both. And I think if we can do that, the sky's the limit in terms of what we will be able to do as a company going forward.
I love everything that you two just said. And you also just pointed out, not the single reason, but one of the big reasons why so many of the new startups fail when trying to work with health systems is their incentives are not aligned and they're trying to, and it can be worrisome. So, I mean, you guys figured that out early and kudos to you and the team for doing that. You mentioned smarter technologies. I want to go back to that. I interviewed Jeremy right like when the announcement went out, which was awesome. But I want to hear from both of you. How did this come to be? SmarterDx and thoughtful AI and access healthcare to form smarter technologies. How did it come to be from your end? And then what you think smarter technologies will be able to bring to market that has been missing.
Yeah, so we started talking with Jeremy and the capital partners, New Mountain Capital, toward the end of last year. And I think from a startup perspective, kind of what you want is more capital to invest in additional products that can bring more value to your customers and, kind of to continue to grow, at a really fast pace. And I think, you know, I was thinking about this, and I think we've all seen where the venture market not just pushes companies to grow, not just doesn't just help them kind of grow, but pushes them to overextend. And that's fundamental to the VC business model, right? Where the way venture deals are structured, which may be interesting to your listeners, are I'll give you $1. If things go south, I get my dollar back. But if things go well, then I get to ride the upside. And so, of course, they push for rolls of the dice. And we were talking to different people, and it just struck us that kind of Jeremy, through his background with Athena, and then R1 and Devoted, and the New Mountain Capital team through their background with CloudMed, which became R1, and were really differentiated in that they weren't just coming to us with a lot of investors don't know anything about the market, and they come to you and they're like, oh my God, my thesis is healthcare plus AI. And you're like, that's not a very deep thesis. And starting to sort of talk about what they were seeing in the market, and that kind of shared customer first angle, really before the specific solution, the shared, like kind of what you said, Jared, about like, let's be aligned with the customer and the problem we're solving. Like that was, I think, uniquely appealing. And really, I think right now with what you're seeing in AI, there's two big things, right? There's AI's ability to deeply understand really complex data. And then there's kind of like what you hear about on the agentic AI side, with AI's ability to then, kind of take action, but not just in a pre-baked way, but like bake in decisions and some understanding. And the sort of, you know, when you look at history, one of the reasons Olive didn't do so well is because the technology couldn't actually kind of perfectly replicate things end to end, and every hospital is a little bit different. And so you end up doing a lot of custom development and it doesn't quite work. And what was so unique about the thoughtful and kind of access angle was you had, first of all, consolidation of workflows kind of through access and knowledge of like how to conduct those at a really high level of quality. And then sort of like you could, use agents to get 90% of that efficiency, but still have people to fill in the gaps, to be the glue and all the little nitty gritty things that don't quite work, with this technology today. And so I think with us, it's obviously the insights on complex data. So you're kind of combining the big waves of AI technology with, kind of a platform that's delivered services across many different parts of revenue cycle at scale, and sort of like going to hospitals and saying, like, we're not here for end to end, to be clear, but we can help you solve, almost any revenue cycle problem in a really deep way. I think is really sort of exciting for us.
I like it. I like what you said about the investors early on too. That's not a shot at investors. That's to take note that maybe you should. There are many out there that are very great, but I had a conversation with this the other day with someone. There are far more that do the healthcare plus AI as the thesis than investor like New Mountain that actually think through and are operators and are really going to dig deep into what is the best solution. Please, a PSA to everyone. We want more of those, right? Right, guys?
More thought partners, right? And more people who are really thinking about, and like, when you try to understand things from what the customer needs, you inherently develop a deeper understanding than when you try to understand things from like just general market trends. And I think, like, at the end of the day, that's our North Star, which is like, how do we help hospitals with what they need? And in that process, kind of reduce the cost to collect for healthcare.
In
Our investors at SmarterDx were great, to be clear, and they were great thought partners. Floodgate and Flare, Bessemer Transformation were awesome thought partners for us. And this was really about how do we get to the next level beyond that.
You're not like once you have the great investors, you weren't going to work with anyone else, right? So I know at Flare the team really well. Like they're amazing. I mean, all those investors that you said are great, but I personally know a lot of the folks at Flare. I'm from Boston originally and used to see them a lot when I was there. I'm just so excited for you guys. Like, so just a couple words each to kind of before we wrap up here. Maybe just a few sentences each. Why Smarter Technologies is going to work? Why is it going to be something that everyone is hearing about? And health systems are using.
There's what health systems care about is outcomes. They care that their problems are solved. And what I think we get in Smarter Technologies is a really, really deep bench of people who understand those problems and a really deep bench of solutions to those problems and people who are really like committing to solve those on behalf of health systems. And ultimately, there are a lot of problems in health system in healthcare, especially in revenue cycle, like we talked about, for all of the reasons that we listed out before at the top of the podcast. But the like that domain knowledge and the ability to apply data, AI technology to solve those problems is unique in the space, and I think is the thing that enables us to solve those problems for health system.
Yeah, there is nobody on the planet that has the perfect solution for every part of revenue cycle figured out. So that's not why this will succeed. I think why this will succeed is, it's not sufficient to have really cool technology, but without an understanding of what customers need. But it's actually also not sufficient to understand the problem, but not be able to leverage, in a true way, kind of new technology to find new ways to solve that problem. Because the problems that persist are, of course, the ones that couldn't be solved with the prior generation of technology. And so I think what's unique about Smart Technologies is we're really combining, that knowledge. I show sort of sometimes when I'm talking about our machine learning team, I'm showing them a slide of talent. The only people I can fit on this slide are people with PhDs from, the Stanfords of the world. Is not a thin layer of technology. And, it is a sort of a team that's capable of reimagining workflows, but with a North Star of a kind of like helping providers who have 1% to 2% margins be able to, continue their mission.
I love it. Guys, it's been a real pleasure. I appreciate the laughs throughout too, kind of hearing some of the early stories. We'll definitely need to have you come back on to shed some more light on just like where things are heading and just any updates in the market. And whenever you have another funny story that comes to mind that you want to share, I know our audience always loves hearing those early stories of what was happening at the company. So thank you both so much for joining me here today.
Thank you.
Thanks for having us, Jared. Appreciate it. It's great.